Comparison of several treatment methods for port wine stain. In the previous video, we mentioned that port wine stain are a difficult to self-heal vascular malformation disease. PWS is a congenital shallow dermal capillary network expansion malformation disease. It is specifically manifested as a relatively flat and rarely raised red patch composed of countless expanded capillaries. It can occur in any part of the body, but it is mostly seen in the face and neck, accounting for 70% to 80%. The incidence in newborns is about 0.3% to 0.5%. If port wine stain is not effectively treated, in most cases, the condition will become more severe with age. More than 65% of patients will gradually expand in the affected area and thicken or develop nodules before the age of 40, seriously affecting their appearance and psychology. At present, there are mainly the following three methods for treating port wine stain. They are introduced from high to low according to their treatment effects. Photodynamic therapy, PDT. This is a method that uses photosensitizers in specific wavelength, 532 nanometers, laser to produce singlet oxygen and other reactive oxygen species to selectively destroy malformed capillaries. PDT has the advantages of good effect, relatively safe, small side effects, lasting effect, and not easy to relapse. It is suitable for port wine stain of different parts and different sizes on the body skin. Pulsed laser treatment. This is a method that uses hemoglobin to absorb pulse laser, 532 nanometers to 1064 nanometers, of a certain band to produce thermal effects, causing the hemoglobin in the capillaries under the skin of the port wine stain area to undergo thermal denaturation and cause blockage in the capillaries of the lesion area. The capillaries undergo further shrinkage due to hypoxia, thereby achieving the effect of treating port wine stain. Pulsed laser therapy is an internationally accepted treatment method for port wine stain. It has a certain therapeutic effect on young children and small area port wine stain, but the cure rate is very low, and there are multiple side effects, such as repeated redness, redredging of originally blocked capillaries, and pigmentation. For adult patients or areas where the disease has thickened or nodules have occurred, treatment is basically ineffective. Surgery. This is a method for treating port wine stain that are ineffective with non-surgical treatment or have thickened or nodules, limb deformities and other serious conditions by using excision, suturing, expansion and other methods. However, surgery may leave obvious scars or patches that seriously affect appearance. In the above comparison, it can be said at present medical level, PDT for port wine stain has the best effect compared to other methods. Now, let us learn something about photosensitizer. In the 1960s, hematoporphyrin derivatives, HPD, were successfully developed. HPD was used to diagnose malignant tumors by fluorescence localization and observed HPD's photodynamic damage effect on human cancer cells. In the 1970s, animal experiments and clinical transitions for HPD photodynamic cancer treatment were completed. Unfortunately, HPD as a first-generation photosensitizer is a multi-component mixture with complex components that is difficult to achieve stable and standardized quality control. The photosensitive reaction on the skin lasts for 1 to 3 months after use. Patients receiving photodynamic therapy need to strictly avoid light for several months at a time, which brings great inconvenience to work and life. The second-generation photosensitizer, hematoporphyrin monomethyl ether, abbreviated as HMME research has found that the yield of singlet oxygen and reactive oxygen species of HMME is several times that of the first-generation photosensitizer HPD. The above characteristics make HMME a highly efficient, low-toxicity and side-effect new-generation photodynamic drug with great application prospects. Among the many second-generation photosensitizers, there is currently a photosensitizer specifically for photodynamic treatment of PWS disease. The trade name is hemoporphin injection, hemoporphin, and the manufacturer is a listed company Shanghai Fudan Zhengjiang Pharmaceutical Company, Limited. Hemoporphin is a blood porphyrin derivative and is currently the only official, China Food and Drug Administration, approved for the treatment of port wine stain in 2017. In addition, according to the announcement of the manufacturer of the drug, on December 21, 2021, it received a written reply from the U.S. Food and Drug Administration, FDA, and hemoporphin's U.S. registration project for the treatment of port wine stain was officially accepted in Phase 2 clinical trials. Friends in the United States can try to pay attention to the progress of this clinical trial. At the end of the video, thank you for coming to my channel. The blogger is a person with real experience in treating port wine stain. The purpose of this channel is to introduce the symptoms of PWS and the latest and effective treatment methods. If you have any questions about treating port wine stain, please leave a message plus your email address and I will try my best to answer them. Thank you.